I would like to introduce our first witness, Mr. Gray Bally. He is an associate professor of the Simmons College of Social Work in Massachusetts and an adjacent assistant professor at the Boston University School of Public Health. He is immediately past president of the National Association of Social Workers and serves as chair of the International Federation of Social Workers, Commission on Policy, Advocacy, and Representation. In 1998, he received the honor of Social Worker of the Year and has received numerous awards since. Today, Mr. Bally will give us an overview of the social work profession, and we will look forward to learning on what social work is and the success and challenges of the profession from him.
Thank you, Madam Chair, and Mr. Davis. It's an honor to have been invited here today to address you and to talk about the state of social work in the United States. My name is Gary Bailey, and I'm proudly an associate professor of social work at Simmons College School of Social Work in Boston, Massachusetts. Simmons was established in 1904 and was the nation's first institute of higher learning to offer training for clinical social workers, and was begun in response to the need to professionalize charity. I feel very fortunate to have been a professional social worker for the past 30 years, having worked in direct services and administrative capacities in the fields of child welfare, gerontology, social work education, and having volunteered in the area of HIV/AIDS early on in the epidemic at the AIDS Action Committee in Boston, one of the nation's foremost AIDS service organizations. As I speak before you today, the nation faces many complex and converging challenges, from our military engagement abroad to rising food and commodity prices and untenable mortgages at home. While each of these challenges individually demand the comprehensive engagement of the nation's social workers, these trends, taken together, suggest a significantly increased need for professional social work services within vulnerable communities, both locally, nationally, and internationally. While it is clear that the nation's social work community will be strained to meet this increased demand, a broader work community and an assessment of the true scope of these demands, along with a comprehensive plan to provide for adequate service to all in need, is of vital importance. I've had the honor of serving as president of the National Association of Social Workers from 2003 to 2005, and currently I'm the chairman of the National Social Work Public Education Campaign. And I join you today to discuss the important role that the profession of social work plays in our society. Social work is the helping profession. Across the nation, the profession of social work and social workers improve and enrich the lives of individuals and families and help build strong communities. Social workers provide critical services in rural, urban, and suburban areas and have long been society's safety net for a broad range of issues, including child welfare, mental and behavioral health, aging, corrections, health, and military and veterans affairs. Much of society only encounters a social worker when dealing with a problem, such as moving a family member from a hospital to a nursing home, and there is limited public understanding of the role of social workers. However, we work to help individuals, families, and communities across the country, and the need for social work services will only grow with time. As chair of the Social Work Public Education Campaign, I have traveled this country and met numbers of people who have a universal awareness of social work as a helping profession. Many people lack, however, an accurate knowledge related to the education and credentials needed to be a professional social worker. They did not appreciate the diversity of the work. They were confused by the use of the more general term of caseworker, which at times is used interchangeably with that of social workers. As the baby boomers continue to age, they will increasingly need social work services ranging from mental health and family counseling to health, education, group programs, and case management. Social workers who provide the majority of the mental health services in the United States will work with the 26% of the American population aged 18 and older that experience a diagnosable mental disorder. Professional social workers will counsel students to prevent high school dropout rates, work with formerly incarcerated individuals to ensure positive community reentry, and help patients diagnosed with serious illnesses such as cancer to make informed decisions about their care. While the need for social work services will only increase with time, we are not equipped to keep pace with this demand, and Dr. Mama will go into that in more detail. The social work profession has existed for over a century and has enriched many lives. 30 years ago, I made a decision to become a professional social worker, and I've never regretted that decision. While it is clear that the nation's social work community will be strained to meet these increased demands, a broader assessment of the true scope of these demands, along with a comprehensive plan to provide adequate service for all in need, is a vital necessity. So today I say to you again, my name is Gary Bailey, and I am proud to be a professional social worker.